Thank you for joining us here today at October's Integrated Care Board for NHS Cornwall and the Isles of Scilly. It's great to have you. Could you let us know what your name and your title and role on the board is, please?
Yes, certainly. I'm Carolyn and I'm the Director of Strategy Planning and Corporate Services for Cornwall and the Isles of Scilly Integrated Care Board. And my role on the board is that because governance sits within my portfolio, I sit here from that perspective, but I'm also a participant of the board.
Lovely. And we've had a really packed agenda today, and it's been some really interesting discussions and debates. Some really exciting news as well. We talked a lot about the women's health strategy, which also looks at the implementation of some new women's health hubs. How important is it that we think about and look at the health of women here in Cornwall?
So everybody's health is really important. We talk a lot about adult health and we talk about children's health, but this is great in the fact that it's actually going to talk about specifically women's health. And the fact that we're going to look at women's health hubs and people will be able to utilise those for things like the menopause, and clearly women's conditions will be looked at more. And that's really exciting because it's not something we've ever had before.
And there's some new funding that backs that up as well to support the rollout. So I think it's over just under £600,000. But you know how important it is as a strategy is in your title, but how this fits into our longer term plans.
Yeah, so it is really important because as a Cornwall and Isles of Scilly Integrated Care Board and as a system, we've recently signed off our 10-year integrated care strategy. So there will be other strategies and plans that will dovetail really nicely into that, realising that our integrated care strategy has been set across 3 cohorts, so starting well, ageing well and living well, and of course children's and women's and things like that are all age, but this particular strategy is going to sit very squarely in that kind of living well and ageing well.
And of course we're not just Cornwall, we're the Isles of Scilly, and at today's board we had the Health Watch Isles of Scilly annual report, which was really interesting to see some of the great work. Although smaller in population, they have a really sort of different set of needs and challenges, don't they, on health-wise. And I was really pleased to see that our Cornwall Foundation Trust are implementing virtual wards for the first time for the Isles of Scilly. How important is it that we think about what the needs are for people from the Isles of Scilly in that long-term strategy?
Oh, it's ever so important. I mean, the Isles of Scilly is a rural coastal community, as is Cornwall. Island living is very different from mainland living, and also how we get services to people on the Isles of Scilly is so important. You know, if we want to take technology into the future, then virtual wards is the way to do that, to stop people having to travel to the mainland, making sure that we can actually do some of those consultations and some of those outpatient appointments via a virtual appointment or a virtual ward is really, really important because it will help in a myriad of ways. It will help from an environmental perspective as well. It will help obviously patients who thinking, gosh, I have to plan a whole day for maybe an hour appointment. So it's really exciting. The virtual ward capacity that we have is something that actually you can look at for other conditions, and we are already looking at that, and we would want to roll that out in the longer term to do much, much more than we currently do.
And we also talked a lot about system pressures and our performance and planning for winter. And I think going back to your point about the use of virtual wards, people are better off at home, aren't they? And that's a big focus for our winter planning.
Yeah.
In our performance report today, we had a look back at how things are now. How important is it that we look at our performance?
Very important that we look at our performance because we need to understand what capacity we have for appointments, what capacity do our ambulance service have, you know, what capacity does our hospital have to make sure that they can actually receive people. So we look at it on a daily basis, we look at it on a weekly basis, obviously we look at it on a monthly basis when it comes to the board in the form of the integrated performance report, but it's also looked at, you know, from a regional perspective. So we need to know our own capabilities in our own capacity, so it's really important we understand what all of our partners are doing and also from a perspective of the services that we actually commission.
And I think that performance and the way the board works, it brings together everyone from all of our health and care services in one place to talk about and focus on what's really important. And you were here today at the board bringing a paper on risks. Yeah. Now, sometimes a bit of a dry subject, but How important is it that we actually are aware of our risks and we plan for those?
So it's very important that we know about what the risks are within our system, because a lot of those risks might be around, how do we monitor patient harm? How do we monitor the risk of all of the ambulances sitting outside of the hospital? So it's really important that we understand what are the risks that affect how we deliver our statutory responsibilities as an integrated care board, but also how do we make sure that it links into your comment about performance. How do we monitor the risks that mitigate under delivering in our performance? So it's really important, and as we're moving to a new way of working in the board, kind of doing one board as in-year delivery and one board as strategic, it's really important that we understand what are those risks in year, so between now and the end of March, that are really going to affect the things that we want to do as an integrated care system. And it's making people aware of those risks and what are the things that we're doing to mitigate that risk. It's so important.
It really is, and with winter coming up, that's probably one of our biggest risks for us, isn't it, as a system? And we're doing some great planning, and just getting people talking about risk and performance together, I think is a really good way to sort of embrace making improvements and changes. Thank you very much, Carolyn. Lovely to see you today.
Thank you very much.